So the 5 warning signs of bowel cancer, firstly, is any persisting change in your bowel functioning, such as diarrhea or constipation, lasting for more than 3 to 4 weeks. Secondly, would be any bleeding from the bowel, again, that's persistent and new. Thirdly is new abdominal pain. Fourthly, weight loss that's unexplained or unintentional and significant. And lastly, if you detect any funny lumps or growths that you can feel in your abdomen or your tummy, those would be the 5 main signs to be aware of. Yes, I think we very much promote people talking about their bowels, talking about their bowel symptoms. And so if you have any concerns over any new symptoms, particularly those we've discussed, then we would encourage you to go and see your GP so they can assess you further. The answer is yes, most definitely. So the idea of screening is to detect either cancer or precancerous growths in people without symptoms, because we know if we do this, then and we say we detect a cancer, that cancer will likely be at a very early stage when it can be cured with treatment, or as I said, we can pick up growths before they're cancerous in the bowel and effectively remove them and prevent them becoming a problem. So particularly screening for bowel cancer is very effective, and there's lots of evidence showing the benefits of this above a certain age. So yes, you should definitely look to have screening before you have symptoms, and the age and way we do this varies. So that's something that you could, when you come and see us, we would discuss with you. So there are a number of ways in which we can screen and test for bowel cancer. And again, that does depend on a number of things, both age of patients and symptoms, and also their preferences for what type of test they would like. Some of the commonest tests are a stool test, looking for very tiny levels of blood in the stool that would prompt further tests, or a test called colonoscopy, which is where we pass a small video camera on the end of a long, flexible scope round the bowel to look for evidence of bowel cancer or polyps, which are the benign growths you get before cancer. But there are other ways, and as always, we would always discuss with you what your preference is over which tests you would like to have. So if we diagnose cancer, then you usually would need a few further tests, and that's to identify the stage of the cancer. And by stage, is it an early cancer, or is it been there a longer time, and has it spread to any other areas of the body? So after the cancer has been identified in the bowel, you would usually have a CT scan, which is a machine that uses lots of X-rays to build a very detailed image of the inside of the body, to look at exactly where the cancer is and is it involving any other parts of the body. And once you've had that done, then we would discuss your case within the team of surgeons and cancer specialists as to what would be the most effective treatments. And treatments commonly would involve surgery to remove the cancer, and also sometimes chemotherapy, which is giving anti-cancer drugs to help ideally cure the cancer.